Ever wonder what potential problems can arise when dealing with chest tubes? Chest tubes, also known as thoracostomy tubes, play a pivotal role in managing various thoracic conditions. They are flexible plastic tubes that doctors insert through the chest wall and into the pleural space, the area between the lungs and the chest wall. Their aim? To remove air, fluid, or pus, thus helping to restore the normal pressure within the chest and allow the lungs to expand fully. From treating pneumothorax, where air leaks into the space between the chest wall and the lung, to draining pleural effusion or empyema, where fluid or pus builds up, chest tubes are indispensable in the medical field. They can be literal lifesavers. However, like any medical procedure, chest tube placement is not without its potential problems. One of the most common issues with chest tubes is malpositioning. This issue is more often than not a result of the chest tube being inserted incorrectly. Imagine a dartboard, and the bullseye is the ideal spot to insert the chest tube. If the dart, or in this case the chest tube, lands anywhere outside of the bullseye, it's considered malpositioned. Malpositioning can occur due to various reasons such as a lack of anatomical landmarks, poor technique, or patient movement during the procedure. It's not as rare as we would like it to be. It's like missing a high five. It happens more often than we'd care to admit. The consequences of malpositioning can be quite severe. The chest tube can potentially damage vital structures within the chest, such as the lungs, heart, or blood vessels. It's like trying to thread a needle with a sledgehammer. You can inadvertently cause more harm than good if you're not careful. In the worst-case scenario, malpositioning can lead to life-threatening complications like tension pneumothorax or hemothorax. It's akin to a ticking time bomb within the chest, waiting to explode. So, how do we identify a malpositioned chest tube? Imaging techniques, especially chest X-ray, are the most reliable methods. It's like using a magnifying glass to spot the error. An X-ray can clearly show whether the chest tube is where it's supposed to be, or if it's taken an unexpected detour. The chest tube should be within the pleural space, the thin cavity between the lungs and the chest wall. If it's outside this space, it's like a ship that's veered off course. It's not going to achieve its intended purpose. In conclusion, malpositioning is a common but serious issue with chest tubes. It's like a wrong turn on a road trip. It can lead to unnecessary complications and even life-threatening situations. Remember, correct placement is key to the effectiveness of a chest tube. It's like parking a car. You need to get it just right for everything to work as it should. Another potential problem to be aware of is infection. Infections associated with chest tubes can occur when bacteria invade the space around the chest tube or the pleural cavity itself. This can happen during insertion while the tube is in place or after removal. Infections may be introduced in various ways. For instance, bacteria can enter the body if the chest tube isn't properly sterilized, or if the skin around the insertion site isn't adequately cleaned. Even airborne bacteria can infect the site if they find their way into the chest tube. So, how can you tell if an infection is brewing? Well, there are several telltale signs. The patient might develop a fever, which is the body's natural response to infection. There might also be pus or a foul-smelling discharge at the tube site. In some cases, the patient might experience increased pain or discomfort around the tube site, or their overall condition might deteriorate. Now the question is, how do we prevent these infections? The answer lies in meticulous aseptic techniques. This includes thoroughly cleaning the skin prior to insertion, using sterile equipment, and ensuring that the chest tube system is always closed to prevent bacteria from entering. In the unfortunate event that an infection does occur, it's not the end of the world. Infections can be treated with a course of antibiotics, often tailored to the specific bacteria causing the infection. If the infection is severe or fails to respond to antibiotics, the chest tube may need to be removed and replaced. It's also worth noting that proactive monitoring is key. Regular inspection of the chest tube site for signs of infection and monitoring the patient's temperature and overall well-being can help detect infections early, when they're typically easier to treat. Infections can complicate recovery, so vigilance and proper care are crucial. Remember, prevention is always better than cure, especially when it comes to something as serious as chest tube infections. So, let's keep those tubes clean, folks. Blockages are another issue that can occur with chest tubes. When we talk about blockages, we're referring to situations where the chest tube gets obstructed, impeding the free flow of air or fluid from the pleural space. This can be due to a variety of reasons, such as blood clots, tissue fragments, or even a kink or twist in the tube itself. The consequences of a blocked chest tube can be severe. One potential outcome is a tension pneumothorax, a condition where the pressure in the pleural space increases to a level that can cause the lung to collapse and shift the mediastinum. This can lead to decreased venous return and ultimately cardiac arrest. It's a dire scenario, to say the least. So how does one identify a blockage? Well, the first signs can be subtle. There might be a sudden stop in fluid drainage or a lack of expected fluctuation in the water seal chamber. The patient might experience increasing discomfort or difficulty in breathing. In more severe cases, signs of respiratory distress such as cyanosis or altered mental status might be observed. Once a blockage is suspected, it's important to take immediate action. Start by inspecting the entire system for any visible obstructions or kinks. If the chest tube appears to be blocked internally, you might need to consider flushing the tube with a small amount of sterile saline. But remember, this should only be done on the advice of a physician, as it carries its own risks. In cases where the tube is irreversibly blocked, it may need to be replaced. This should be done promptly to prevent complications. Remember, always monitor the patient closely during these procedures, as their condition can deteriorate rapidly. In summary, blockages are a serious problem that can occur with chest tubes. They can lead to life-threatening conditions like tension pneumothorax, so it's crucial to identify and manage them quickly and effectively. Remember, a blocked chest tube can be life-threatening, so immediate action is necessary. Accidental removal is a problem that can be quite alarming. Picture this: you're in a clinical setting, perhaps a hospital or a clinic, and you're dealing with a patient who has a chest tube inserted. Suddenly, the unthinkable happens. The chest tube is accidentally dislodged or removed. This can happen in a number of ways, but the most common is probably patient movement. Whether it's an unexpected shift, a sudden cough, or even a sneeze, these simple actions can sometimes dislodge the chest tube, leading to accidental removal. Other times it could be due to a snag on the patient's clothing or bed sheets, or even an inadvertent tug from a healthcare provider. Now, why is this a problem? Well, an accidentally removed chest tube can potentially lead to a life-threatening situation. Remember, the chest tube is there to drain air, fluid, or blood from the space around the lungs. If it's removed, these substances can accumulate and cause a lung to collapse. This is known as a pneumothorax. It can also lead to infection or bleeding, both of which can have serious consequences. So what do you do if you find yourself in this situation? First and foremost, don't panic. Stay calm and reassure the patient. They're likely to be just as surprised and scared as you are. Next, you'll want to cover the site immediately with a sterile dressing. This helps to prevent air from being sucked into the chest cavity, which could make the pneumothorax worse. You'll also want to position the patient on their side, with the affected side down. This can help to prevent further air or fluid from accumulating. Following these immediate steps, seek emergency medical assistance. The patient will likely need a new chest tube inserted, and possibly other interventions, depending on the specifics of their condition. So, while accidental removal can be a shocking event, remember this: quick and calm action can mitigate any harm. Knowledge and preparation are your best defense against this potentially serious complication. You've got this. While accidental removal can be shocking, quick and calm action can mitigate any harm. Re-expansion pulmonary edema is a rare but serious complication. Now let's delve into what exactly this is. Re-expansion pulmonary edema, or RPE, is an unusual occurrence that can happen after the rapid re-expansion of a collapsed lung, typically following chest tube placement. So, how does it happen? Well, when a lung has been collapsed for a significant period, the blood vessels and lung tissue may become more permeable. If the lung is then quickly re-expanded, fluid may leak from these blood vessels into the lung tissue, causing edema or swelling. This is the phenomenon we call re-expansion pulmonary edema. Now you may be wondering about the symptoms. These can range from mild to severe, and can include shortness of breath, cough, chest pain, and in serious cases, low oxygen levels in the blood, which can cause a blue discoloration of the skin and lips. But don't fret, there are ways to prevent and manage RPE. To prevent RPE, it's crucial to re-expand the lung slowly, particularly in cases where the lung has been collapsed for more than 3 days. This usually means draining the fluid or air causing the collapse at a controlled rate, rather than all at once. If RPE does occur, management is primarily supportive. This could involve providing supplemental oxygen, and in more severe cases, mechanical ventilation may be required to support breathing. Medications to reduce the fluid in the lungs, known as diuretics, may also be used. It's important to remember that while RPE is a rare complication, it's also a serious one. and the key to prevention is careful and controlled re-expansion of a collapsed lung. In the world of medicine, knowledge is power, and being aware of complications like re-expansion pulmonary edema can make all the difference. It's one of those situations where an ounce of prevention truly is worth a pound of cure. Though rare, being aware of this complication can be life-saving. So let's keep learning, stay vigilant, and continue to strive for the best patient care possible. As we have seen, chest tubes, while life-saving, can present several potential problems. Indeed, they are a double-edged sword. Let's recap the main points about these problems and their solutions. Firstly, we discussed malpositioning. This happens when the chest tube isn't placed correctly, potentially causing ineffective drainage or even injury to nearby organs. The solution here is vigilance and precision during insertion, as well as regular chest X-rays to confirm correct placement. Next, we tackled the issue of infection. Bacteria can enter the chest cavity through the tube, leading to a condition called empyema. To prevent this, strict aseptic technique during tube insertion and maintenance is crucial. Antibiotics might be necessary if infection sets in. The third problem we explored was blockage. This can occur due to blood clots or tissue debris obstructing the tube, preventing effective fluid or air drainage. Regular tube maintenance, including milking and stripping, can help keep the tube clear. In severe cases, tube replacement might be required. Then we delved into accidental removal. This can happen if the tube gets pulled out unintentionally, potentially causing a collapsed lung. Securely taping the tube and educating patients and caregivers about its importance can help prevent this. If the tube is accidentally removed, it's an emergency situation requiring immediate medical attention. Finally, we examined re-expansion pulmonary edema, a rare but serious complication that can occur if the lung is re-inflated too quickly. To avoid this, it's essential to control the rate of lung re-expansion, especially in patients with chronic lung collapse. In summary, the challenges of chest tube management are many and varied, but with knowledge and meticulous care, most can be prevented or effectively managed. Remember, the goal is not just to do no harm, but to maximize patient comfort and recovery. Knowing these problems and their solutions is vital for anyone dealing with chest tubes, ensuring the best possible patient outcome. So there you have it, a comprehensive guide to the potential problems of chest tubes and how to tackle them. Knowledge is indeed power, especially in the field of medicine. Today, we've navigated through the labyrinth of chest tube complications, from malpositioning to infection, blockage, accidental removal, and re-expansion pulmonary edema. But remember, this is just the tip of the iceberg. There's a whole world of medical knowledge out there waiting for you to explore. Every case, every patient, every complication is an opportunity to learn, to grow, to become a better medical professional. Just like the art of medicine itself, learning is a continuous process. It's a journey, not a destination. As we delve into the intricacies of chest tubes or any other medical procedure, we must bear in mind that the ultimate goal is always the betterment of patient care. It's about making a difference, one patient at a time. So, let's not stop here. Let's continue to expand our knowledge, sharpen our skills, and strive for excellence in all we do. Don't forget, it's okay to make mistakes. In fact, it is through mistakes that we learn the most. But what's important is that we learn from our mistakes, and we use that knowledge to avoid repeating them. We should always aim to turn every problem into a solution. To paraphrase a famous saying, in the middle of difficulty lies opportunity. Keep that passion burning. Keep that curiosity alive. Let it fuel your pursuit of knowledge. Remember, the day you stop learning is the day you stop growing. So let's keep pushing the boundaries. Let's keep challenging the status quo. Let's keep exploring the unexplored. Only then can we truly make a difference in the world of medicine. Stay vigilant, keep learning, and remember, every problem has a solution.